All right, Chuck. Well, if you've been to the doctor or walk-in clinic recently, you likely weren't alone and waited a long time to see someone.
Any way to avoid that wait? That is our topic today. Joining us for our Doctors on Call and avoiding that winter virus crush is Dr. Mark Meeker with OSF Healthcare. Let's talk about the crush you've been seeing and get a perspective on how intense it's been for you folks.
Well, it has been intense. There's a lot of viruses out there, especially this time of year, and we've been pretty busy with it.
Yeah, so just talk about the process of telehealth, how it works, and what can people expect for those who may have never used it before.
So telehealth gives us another avenue to see patients or to take care of patients without them having to come into the office. There's different venues in telehealth. There's sometimes just a simple telephone call where there's interaction between the clinician and the patient over the telephone. What we really prefer is a video visit where we use their smartphone and our computer system to be able to see people on video as we talk with them and do the visit that way. And then there's some other ones like asynchronous visits over the computer where it's not in real time, but the patient can send in a question. We can review the chart, review the records, and then interact through the computer.
Do you need a certain type of software? Folks might wonder, oh, do I need to download this app? I don't like apps.
No, it's mainly through the MyChart app with OSF Healthcare. So if you have a physician or a relationship with OSF and you have a MyChart account, we use that platform to interact. And as long as the patient has a smartphone, that's really all they need. If they don't have a smartphone, we can do these over a regular telephone, but that eliminates the video part.
And can you get in really quickly, faster than going in, I'm sure?
Yes, usually we have access, not just through our primary care offices, but also through our on-call colleagues who have access available basically 24/7.
Okay.
And can you really assess what a person is dealing with if you can't touch them? Like, let's say you've got a lung issue and you want to know, is there something deep in that lung? How do you assess that with telehealth? Sometimes you can't.
Yeah. So it's a very good question. So, we don't expect patients to know when they should do a televisit versus an inpatient or an in-person visit. But if they just contact us and tell us what they need and we get some initial questions, we can determine what's appropriate for a televisit versus we really need you to come in. And if they need to come in, obviously the best option we think is their primary care team. They know them, they have a relationship with them. But we have a lot of other options. Again, we have our on-call urgent care centers scattered throughout Peoria. We have a couple of prompt cares. And we have the virtual visits through on-call if they can't get in. So there's quite a few options. The key is just contact us and let us help you with that.
And doctor, can you talk a little bit about the cost? You would think maybe, is it the same price? Is it cheaper? And does your insurance cover it?
Those are really difficult questions because there's not a universal answer. But in general, they're cheaper than an inpatient or an in-person visit. Coverage is pretty good, and Medicare and Medicaid have extended the coverage beyond the pandemic. But the private insurance is kind of hit and miss. If you have questions about that, the best thing to do is to contact your insurer and ask them. If somebody doesn't have insurance, doesn't have coverage, we do have a flat fee, and yes, it would be cheaper than a face-to-face visit.
Let's say you feel like you need some kind of medicine, but you're hesitant to go wait in that line. Will a doctor prescribe medicine, whether it's an antibiotic or a strong cough medicine, by telehealth?
We give a lot of advice via telehealth. We do prescribe medications, not infrequently via telehealth, but it's a little bit trickier if you can't examine someone. But some things are straightforward with medications, and you can do it via the telehealth. Sometimes it's not so straightforward, and we might ask you for a visit. Are you seeing a lot of people use this option right now? That's an interesting question, too, because we've been talking about this a lot. We make it available, and we encourage it, but a lot of people still want that face-to-face visit. Because as good as the technology is, there's nothing like a human interaction face-to-face.
What's it like for you as a doctor? Which one?
I'm getting used to it.
Yeah.
And there are some things, quite frankly, that I would actually prefer because it's quick, it's easy, and if I don't have to examine someone, if there's an issue I feel I can take care of just with information, it's a great way to do it. But if somebody needs an exam, then an in-person visit is usually preferred.
Yeah, it definitely can save some time, right now.
Absolutely, it definitely can.
All right, thank you so much for being with us, doctor, and we'll be right back after the break.